Welcome to my channel, or welcome back. I'll be sharing a VBAC story today by Taylor. Her Instagram will be in the description below. She has a makeup page, so please follow her on Instagram if you're into makeup. There are certain points that I want to highlight in her birth story and throughout, such as VBAC, which is vaginal birth after cesarean, switching providers, if you've had a provider or you had a bad birth experience with. I want to start by sharing briefly her first birth experience. So here's a trigger warning that the beginning of this video could be triggering to some. Not all cesareans are traumatic, but some people can find the experience to be. I need to hold space for each person's traumatic birth story as well as their positive birth stories.
About close to 40 weeks I went because I knew I was leaking fluid like pretty much all day. Like, I was really leaking a lot. I went in, they asked me had I eaten enough and was I counting her kicks and am I drinking enough water and like all these questions, and of course I was, but I had said that she wasn't moving as much as she probably should have, but I was also a first time mom, so like I didn't really know any better. But the nurse that I had was awful. The triage nurse was very concerned with like getting this one done, as she said, and then she was going to go on her lunch or something like that. And so she was like very dismissive, told me it wasn't a fluid leak, and then relayed that message to my doctor. I went home, first time mom, continued to kind of leak a little bit, but it wasn't anything crazy. But I did everything that I could to get my daughter to come because they wanted to induce me, and I had already pushed it from 40 weeks to 41. I told them I didn't want to be induced at 40. So she said she was only comfortable going till 41. And so I basically just leaked for that whole next week until I went in for my induction. I went in for my induction at about 8 a.m. on a Monday morning, and they gave me, I want to say it was misoprostol or something like that. It was something oral. They gave that to me to soften my cervix. I was not dilated. I was not thinned out, nothing. My cervix was still like completely closed up. So they gave me something to soften my cervix orally. And then after that first dose that I got, her heart rate just started going insane and like dropping off the monitors. And then I had like 5 or 6 nurses come in and like crowd around me, and they were like flipping me and screaming for my doctor, saying that I needed an emergency C-section, like, you know, just scaring me for no reason. My doctor came in and broke my water, broke my bag, but there was no water. Like, nothing came out when they broke it. My husband said there was just some blood and that was it. There was no fluid. She literally just came in and broke my water. Nobody told me what they were doing to me. They just came in, put oxygen on me, broke my water, and then, which was very painful. And then she put a monitor on me, which was that little one that screws into the scalp of the baby and comes out and sticks to your leg. So she said if the heart rate doesn't stabilize within the next like 30 minutes and stay stable, she was going to have to give me a C-section. So luckily it did stabilize, but as soon as they like broke my water, I had contractions like a minute apart from each other that I couldn't even breathe through. I asked for the epidural because I couldn't breathe through the pain of the contractions, and it took probably like 4 hours for them to get me an epidural because my doctor was delivering other babies and whatnot, and it just took forever for me to even get my epidural. But I finally got that, and we were just kind of settled. And literally me and my husband were about to watch a movie, and her heart rate just dropped right back down to 0 again, and then it was stable, and then it was not, and then it was stable, and then it was not. And then about 10 p.m. that night, they said, we have to do a C-section. I didn't really get much of an explanation. I was a first-time mom, and I was just pretty much like, okay, I mean, if that's what I need, I just want my baby to be here safe. I didn't really get a chance to dilate. I didn't get a chance to labor. I mean, obviously I labored because I felt the pain of the contractions, but like I wasn't making any progress. So my daughter was born at 11:46 p.m. that night, and she was perfectly healthy, 8'5". She's literally the same size as my son, but they didn't really give me much choice. You know, I really did like my doctor throughout my pregnancy, but the end was pretty rough, and I was really traumatized because I literally got a C-section with no explanation.
I have heard a lot of traumatic birth stories where the birther just is not believed. Like whether they say that they feel like they have a lot of fluid in their ankles or in other parts of their body, or they feel like something's not right and the birther just isn't believed. So I think that it's really important for providers, you're a nurse or something like that, it's really important that we listen to birthing people. This can really cause problems. That's not how we want birth to go. But when things get dismissed, such as that, that's what can happen. She mentioned that she became educated and switched providers, and I think that the care that we receive is super important when we're planning to give birth. You're looking for a provider that you want to meet certain needs. I would try to look up some reviews just to get a feel of what their practice is like. Ask people in your community who they see, if they like them, if they don't, pros and cons to their birth experience. Ask people about their birth story. If you're pregnant, go into listening to these birth stories knowing that you may hear some things that might make you uneasy. So maybe birth stories while pregnant isn't always a great idea, but if you can listen to a birth story and not feel triggered or distressed or upset by what you're hearing, it could be important. I think the first thing that you can do when searching for a new provider is just to find someone that you might click with. Another thing that you can do is try to figure out where your birth made you uncomfortable, or even your prenatal visits. Make a list of everything that you did not like about your birth experience, about how you were treated, about the office, about the provider. Just make a list and kind of figure out what you would like in a provider, and that'll make you more aware of what your beliefs and values are. Also begin to ask yourself, what preferences do I have in childbirth? Do I want pain medicine administered? Do I want to try to do things more naturally? Do I want to go into labor on my own? Do I want an induction? What happens with an induction? What are the pros and cons? What are the pros and cons with medication and epidurals? Ask yourself all of these questions and figure out your preferences that way. And also, always try to educate yourself. I'll always try to provide free, accessible, or any sort of resources that can help educate you. Evidence-Based Birth's website always has jam-packed information and resources, and it's free. So always go to that website if you're not in the place where you can financially afford something like childbirth education classes. Of course, there are some people who offer like free classes. There's also no shame if this is like your third or fourth child and you're just now wanting to get more educated. You can never be too educated. You can never have too much information. Of course, we learn from each and every birth experience that we have, but there is no shame in finding outside information and education for your birth. See if the provider that you're looking into is accepting of your beliefs and preferences, such as VBAC. Where I live, there are not many providers in the surrounding areas at all that will let you attempt a VBAC, but there is one, so that's good, and many people have successful VBACs at this hospital. Not only look and find out if they do VBAC, look into other things, like interview them kind of. I don't feel like a lot of OBs and stuff do consults, but you can just make an appointment if affordable and accessible to you and get to know them and say, like, if I was giving birth, what would it look like at your hospital? What are your hospital policies? You can even tour the hospital for free that provider works with for free where I live. I don't know about everywhere else. I'm sure it might be. You can tour a hospital and ask questions like if you want labor to be more natural, if you can have a water birth, and questions like that that you might have. So write down whatever questions you might have before your first appointment with your possible new provider or before you tour a hospital, and just see if what they offer matches up to what you want. Of course, if you find this provider and you think that they're going to meet all of your needs in childbirth, and you see them for a while with prenatal visits, and you begin to not like them, feel unsettled, feel unheard, feel dismissed, you don't like what you've learned about the hospital, or not only how they're treating you, but how their office is ran, you can switch providers literally anytime in your pregnancy. I just know that you can fire whoever if you don't like them. You don't have to do all these things that you think that you have to do. You can question everything that you're told. I recently had a friend who just gave birth, has a new sweet little baby at home. She just switched providers like 30 some weeks into her pregnancy. I've known of people to even get out of hospital care 38 weeks into their pregnancy. I don't want to suggest that for everyone, because switching care may not be accessible to everyone. Home birth may not be accessible to everyone. If you're able and you know of another obstetrician like my friend that you like, you can always switch to that practice. Now I'm gonna share the birth story. This birth story again is a healing VBAC. Taylor's baby was born on 4/6/2020. Giving birth during the great COVID-19 pandemic was definitely an interesting time. After a traumatic C-section in 2016, I was determined to have a VBAC with my second child. I got myself a doula, planned for my sister who is a massage therapist to come help with pain relief, and also hired a birth photographer to capture the moment. My due date was April 11th. In the last month leading up to the birth of my son, my husband was not allowed with me at my appointments. I was required to wear a mask, sign paperwork stating I hadn't been exposed, and my temp was taken at each appointment. We took all the precautions of keeping ourselves as distant as possible and everything sanitized. My husband is considered an essential worker, so he continued to work through quarantine. Hospital policy was constantly changing, but ultimately they made the decision to have only one support person allowed with the birthing parent. Given I had never gone into labor before, my daughter was induction that led to a cesarean, I didn't know what to expect. I was 39 weeks. It was a Saturday morning and I started to feel contractions. They would come and go throughout the day, but I definitely felt it was coming. Her contractions would come and go throughout the day, but I definitely felt it was coming. Come Sunday morning, the contractions were getting closer together and I decided it would be best to have my mom come get my daughter. Luckily, she had been quarantined as well. I remember feeling extremely emotional, not knowing what to expect at all. I called my midwife to see what the best plan of action was. She told me to continue to monitor my contractions, get some rest, take a bath, and make sure to eat. I feel like midwives always say to relax and take a bath, because whenever I was stressed and whenever I was having a lot of contractions but labor hadn't started yet, my midwife would always say, take an Epsom salt bath, some magnesium flakes in there, drink a lot of water, and do your best to relax and rest and stay hydrated. And it might sound like, like at first, but it really does help. I did just that and continued to labor at home all day. By around 9 p.m. Sunday, I felt it was time to go and at least get checked out. So she labored at home, which I like to suggest to folks who maybe want less intervention, because they don't always admit you to the hospital right away when you're in labor too. Often than not, you get sent home if you're not at a certain point in labor. The hospital was a 35-minute drive, and even though I had never gone into labor before, it was still my second baby, so I didn't know how quickly he would come. When we arrived at the hospital, I had to enter through the ER. I was screened at the door and my husband was not allowed to come in with me. They wheeled me up into labor and delivery and got me on the monitors. Of course, my contractions decided to start spacing out as soon as I got there, but I was dilated 1 centimeter and 75% effaced. My midwife gave me the option to stay, but encouraged me to go home and labor more. I really like this midwife's allowing her patient to call her, telling her and reassuring her that labor is there and to just relax. And then this last part, go home. Try to encourage your labor to pick up more there. From the birth story I shared a few weeks ago, and even last week's birth story, some folks stall at the hospital, or their labor stalls. And that's not to say that everyone's labor will stall as soon as they get to the hospital. But whenever you're put in a certain situation and with everything going on, it's kind of nerve-wracking. And when you're anxious, your labor can stall. And what happens is it's kind of like a fight, flight, or freeze response. So if that's what's happening with this birther, I'm not trying to diagnose whatever the situation was. But I do like what the midwife said, go home, progress some more, come back in. But she did give her the option to stay as well. I think the options are what matters and what's important. She said, I will for sure know when it's time, and sometimes you progress faster at home. Just like I said, sometimes when you're in the comfort of your own home, you're relaxed, you're not under fluorescent lighting, you're not in a cold space, you're familiar with your home and you're more comfortable there. You can walk around without your pants on and no one will care. So I really like this midwife so far. I was happy to leave because I wanted to be with my husband, and I don't blame her. It would be extremely difficult for me to attempt birth without a familiar face. Besides, like, you know, a midwife, but a midwife isn't there the whole time that you birth. So that would be really hard, and I really feel for everyone giving birth, or that has given birth and giving birth now. I was really hoping things would progress faster being in my own environment, and they sure did. We got home around 11:30 p.m., and I did my best to get comfy in bed and try to get some rest. Nothing I did helped ease the pain, and the contractions started becoming more consistent and unbearable. So I don't know why I just got so excited and my voice like picked up, but again, I just get so excited when people are like in labor, and I always tell birthers to listen to the consistency and intensity of their surges, because we can go by, like, also if they're timeable and all that. I think that intensity is a great measure of how far along you are in labor, but we all have different like pain tolerance, I guess. It could feel different to me versus someone else, but still, I think that's cool. I texted my midwife and she advised me to try to take another bath. She said if they do not subside in the tub, head back to the hospital. They did not subside. I could barely speak between them. We headed back to the hospital and arrived around 3 a.m. I consented to a cervical check. I was 3 centimeters and 100% effaced. I was then admitted. They asked if I wanted the epidural and I said yes. I was so exhausted at that point, I just wanted to regain some strength and get some sleep. By about 5:30 a.m., the epidural was in and I was finally able to rest with the peanut ball between my legs. I discussed this, I think, in a video before too, that a birther used a peanut ball, and it may not work for everyone, but for most people it does help with dilation. And I'll pop up a picture of a peanut ball because some people don't know what it looks like. Peanut balls can be really beneficial, especially if you've had an epidural. It helps your body open and dilate. A few hours later, not even sure what time, I was checked again and made it to a 4, so she was 4 centimeters dilated. We then decided to break my water and try to get things moving. I also consented to a very low dose of Pitocin. Within an hour, I went from 4 to 9 centimeters, and it was almost go time. My midwife rolled me on each side and applied some counter pressure on my hips to give me that little push I needed to get to 10 centimeters. There's 2 things that I want to comment on right there. I love this midwife again, so maybe 3 things. But I love this midwife because not only does this birther know that she needs to consent to things, but everyone's listening and asking. They're not telling her what to do. They're giving her the option to consent, because some birthers feel optionless. They really did not consent to things and then it happens. But I like that Taylor is mentioning the word consent because it's such an important word in birth. And I also like that the midwife is involved and she's doing the counter pressure and the hip squeezes. I've literally never heard of a provider other than like at my home birth being that involved with a birth. I think that's awesome. I did a few practice pushes and then my epidural really started to wear off. I felt every contraction in her scar. Ooh, that sounds awful. I don't know what it feels like to have a cesarean scar, and maybe this is a trigger warning for some with scars or things that might remind them of maybe a difficult experience. I have heard that some people still feel pain where their cesarean scars are and even burning. That's not abnormal if you feel that. Not to say that it's like normal, I just think that it's common. My son decided to flip posterior while I was still in labor, so I really had a hard time to get his head past my pubic bone. Okay, so I want to interrupt the story for a second, because she's literally so educated. I'm so proud of her. She knows the position of her baby, she knows counter pressure, she knows about consent. These are all of the things that you can educate yourself on. You can have a medicated birth with an epidural and Pitocin and all that, but still be able to consent to things and feel empowered and positive about your birth. I love this story so much so far. I'm gonna stop talking and keep reading. I pushed for 2 long hours and finally gave it one last effort, and he came out in one push. My son was finally here. It was just me, my husband, my nurse, and my midwife. It was the perfect experience despite COVID changing all of the plans. I didn't get my birth pics, I didn't get to have a doula or my sister present, but I rocked my VBAC birth during a global pandemic, and that's pretty cool. My healthy baby was born at 39 weeks and 2 days at 8.5 pounds, 21.5 inches long. His name's Waylon. I was discharged after 24 hours and we were on our way navigating life with 2 kids. Our hearts are so full and we can't wait to tell him his birth story when he's older. Giving birth during a global pandemic in itself sounds really scary, and then to do that and overcome past birth trauma. I'm so proud of you, Taylor, and I'm so glad that you got the positive experience that you deserve, Taylor, and I'm so glad that you got the positive experience that you deserved, because you're worthy of a good birth experience.